that we should know about Ebola? The first case is now confirmed in the United States. What does this mean?
Well, this is the largest Ebola outbreak that we've ever seen since the virus became first recognized in 1967. So more people have died during this outbreak than all other outbreaks combined. It is not surprising that given globalization and air travel and the way people move around the world so frequently, that we are now, for the first time now, seeing a case here in the United States.
And so, what should people know as far as, is it contagious?
So first question, what about all the people on the plane? Do they need to be quarantined? This virus does not transmit until the patient becomes symptomatic. But once the patient becomes symptomatic, then individuals who are having close contact with the subject are at risk and need to be quarantined, and all those contacts run down, quarantine. That's how you maintain control of the virus, and that's what's not working well in West Africa now.
And what are the symptoms that people should look out for?
Fever, headache, vomiting, severe muscle pain, abdominal pain, bleeding.
That could be
A lot of things, yes, a lot of things. I mean, you know, so those symptoms combined with recent travel to an area where Ebola is known to be spreading, you need the combination of those two things. But you should always, we need to have a healthy alert status in terms of we know that there's an unprecedented Ebola epidemic, outbreak that is occurring in West Africa. So we need to be on guard.
And I mean, that's if I recently went to Africa, but what about somebody that might be on BART that...
Or someone who took a plane out of Liberia to Europe and then came to the United States? Yes, those are the kinds of scenarios that have public health officials worried.
Well, how can I protect myself, just in case?
Well, I mean, it requires a close exposure to bodily fluids of an individual. But, you know, and if people are healthy, they're not going to spread the virus. It's really sick individuals, and only those individuals who are sick with Ebola virus can spread Ebola virus, of course. So, I mean, there's no, there's no test. There's no way of saying, oh, you have Ebola, except by doing a very sophisticated test that the CDC runs. So those are the, I mean, it's not, there's nothing you can do. You can just hope that the virus is not here in the United States.
Meaning the person that has it just carried it here?
No, I mean that there's not an outbreak occurring here. If in fact this individual was quickly diagnosed, all the contacts traced, everybody quarantined, then you've bottled up the virus. And so we can then manage, if those people become ill, we can manage their illnesses, just as we are managing the 4 physicians and the nurse who came back from West Africa, and all who have survived.
Okay, so pretty much.
Obviously, a lot of paranoia, a lot of fear, and the mathematical chances of being exposed to someone with actual Ebola virus disease is still minuscule. But it's not zero, as is evidenced by the single now individual in Dallas who acquired the virus and came to the United States. Hopefully not spreading the virus to others. We don't know that yet, but the reason we're talking is that this is a rare but very scary event.
Mm-hmm. And pretty much, like you said, it would just have to be, bodily fluids in
Right.
order for us to get it. Meaning like kissing, Or if
Yes,
there's a
saliva,
cut?
saliva, blood, feces, vomit, any type of bodily fluid can spread the virus. The mortality rate for this virus, the West African strain of Ebola Zaire, is about between 50 and 55%. There is no treatment. There are no vaccines currently. So it's really supportive care, hydration, control of electrolytes, really just supporting the patient through their illness. Now there are some exciting potential advances. The development of antibodies against Ebola that could be used, that's the ZMapp. There are different technologies that are being brought to bear in terms of targeting the virus, new antivirals, but none of these have really been tested and fully vetted. We now, of course, with this outbreak occurring, there is a rush to further evaluate and deploy these reagents. ZMapp, for example, was given very early, but the entire world's supply of these monoclonal antibodies was exhausted within the first few patients.
So, doctor, why are people allowed to travel to and from Ebola hotspots?
Well, travel is being restricted. Many African countries are closing their borders to individuals from the hot zones, if you will, of West Africa. Several airlines are canceling flights into West Africa. So there's still some travel, and of course that travel creates a potential risk for someone who's exposed bringing the virus out of West Africa.
So Erica Oliver Heibel asks, should people with immune deficiencies take any additional precautions?
This virus does a very good job of attacking the immune system and overwhelming the body of people with perfectly fine immune systems. What distinguishes the people who survive is the ability to make a neutralizing antibody response against the virus. And so people with immunodeficiency may be less able to make those types of neutralizing antibodies, and therefore mortality rates might be higher in an immunodeficient individual.
So there's nothing they can do to help make their immune system stronger to fight it in case it happens?
No, one approach would be to receive these passive antibodies, ZMapp. But those monoclonal antibodies, the world supply has been exhausted already. So there's a rush on now to create more of these antibodies. But in the long run, what determines the people who die and the people who live is whether the survivors make this neutralizing antibody response.
Jerron Roberts asks, how fast can this spread to the Bay Area?
Well, one doesn't know, but this virus does not spread like influenza, the epidemics that sweep through the country in the winter. This is not that kind of virus. The exposure needs to be, it's not respiratory droplet spread. It is close physical contact with bodily secretions. So the spread will be slower.
Are any Bay Area hospitals prepared to treat Ebola?
I believe that any U.S. hospital has the capability, the infection control capabilities to manage an Ebola-infected subject. Now, so far, the individuals have been, people the doctors and nurses who've come back have been admitted to the very high level quarantine facilities that, for example, that were maintained for officers in the CDC that might be coming back with some kind of new contagion, an unknown. And so that certainly those facilities are specifically designed to care for this kind of virus. But I think our normal hospital system could handle Ebola. It's important to recognize and diagnose it and to implement the right type of protective gear for the doctors and the nurses. This is a virus that really takes out the healthcare workers because they're often exposed to the patient without knowing they have Ebola, and because of giving care to the patient, they have the contact with the bodily secretions and acquire the virus. So this is a virus that targets the healthcare worker. So we need to have a high suspicion and to quickly move to the appropriate type of quarantine with wearing of protective equipment and isolation facilities, which most American hospitals, I think U.S. hospitals could handle.
Jennifer Conda wants to know, how long was the patient in the ER waiting room, and why did the hospital wait 24 hours to isolate the patient?
I don't know the particulars around the early case management here, so I could not comment on that.
What can we in the U.S. do to protect ourselves?
So we are safe. We have a very fine healthcare system. We are on alert, on guard for this virus, as is evidenced by the case in Dallas. Picked up very quickly, quarantined, contact tracing underway, protective equipment being used by healthcare workers. These are the tried and true ways of controlling an Ebola virus outbreak. And here in the United States, we're very well prepared to do that.